Hello, Abusiafo. Welcome back to Health Facts Ghana. And this is part 2 of COVID-19 vaccine. Part 1, you questions be brave, answer questions be brave about why we should take the COVID-19 vaccine. But I know that there's so many questions that have been asked about COVID-19. We couldn't explore all the questions and answer all the questions. Into part 2, yaje questions about COVID-19 na yede mwaye so aba. Yedwumadi a yede no, the here pan say all the myths, all the rumors about COVID-19 and other diseases that we'll tackle in the future. No, we want to bring the facts out. We want to give you credible information so that you can make good decisions for your family, for yourself, and for your whole community. Again, my name is Dr. Prince Ochre. I'm a physician in the United States, in Ohio. I'm also a student of public health at the Harvard University School of Public Health. And yes, I was Dr. Samuel Boateng. Dr. Samuel Boateng, Kabibi Kakrafo Anhwe.
Pacho, Miss Meeting at Samuel Boateng. I'm a clinical pharmacist in Ohio, or United States, I have say. I'm also a board certified pharmacotherapy specialist. And you know, chuma di na say yebema yebe educate ye ho ana say nimde kakra nyame adom ye won so no ye na ye ho so ebeche na afi yenya apomodempa.
Without spending too much time, we will go on to our first question. Let me say a idea. First question, first video, we talked about why it was important to get a vaccine. But there's one question that we didn't answer. Who should not get the vaccine? You will be only any say vaccine or GB and Dr. Boateng and Asami Boyna ne answers that question in my end.
Oh, I think say I was say yehu and say vaccine clinical trials they limited it to a certain category of people. And say in the US you have 2 vaccines, the Pfizer vaccine and then the Moderna vaccine. For Pfizer vaccine, the age cutoff is 16 years. And anybody and I say Akrabia only 16. And I'm saying young study those population in the clinical trials, it's not recommended to give it to Nkra or Motisa. And Moderna, the cutoff was 18 years. And I won't be here for now. They made me say Nkra. The age limit, it's not recommended for them to be used. And I think you'll be to say pregnant women. The reason being that it wasn't studied in them. They were not included in the clinical trials. And ama didn't say ube timia akano outright say it's safe for them. However, there have been several expert opinions on this, at least based on other studies and from experience. Are more recommended say it may be, and I say it is safe in pregnant women. And some of these groups have put up expert recommendations out there. With that being said, and then considering the fact that say young header and steady vaccine in a mass of say if you're pregnant and you want to before you get a vaccine, it's recommended say you have a conversation with your gynecologist or your primary care provider to decide if you should go ahead and then take it. So right now, that is where it stands now.
Okay, thank you so much, Sammy. I'm saying medical I'm say as you said, the data per se, we cannot extrapolate it to them, but you share information, independent na saying whilst they were in a trial, but the if it was safe in those patients. Now you share na ɔmanya furu a enya COVID ne bi no, the morbidity and mortality no anaasɛ sɛ yare no so ɛyɛɛ wɔn no anaasɛ ewuo no na ɛno yɛ higher ɛwɔ saa apemfoɔ. Nti no sɛ wowei side effects ɛne anaa pros and cons na ɛm sɛ ɛno na wɔka ho asɛm sɛ expert opinion sɛ ɛbɛnya a na wo ne wo doctor ɛka ho asɛm a obi anyinsɛn a ɔho kwan sɛ obɛtumi agye but ebia state biara bɛwɔ no different interpretation and as sɛ no say administer medication no. Nti no just know what your state is the guidelines is, and I'm sure sɛ Ghana so ɛkɔduru hɔ nso a ebia the way ɔmbɛ interpret saa anaasɛ ɔmbɛfa data no bɛyɛ different kakra.
And I may be accounts and sounds now obi so am fan say all breastfeed or wow for frozen. And I'm say again yan steady or our population, you know. There's no specific answer. It is assumed by expert opinion to be safe. But again, said Eddie can say if you're in doubt, make sure say you get in touch with your gynecologist or your primary care physician and have that talk with them. Now only among kasa sebe mbema akwankyerɛ a ɛsɛ nefota ɛsan sɛ obiara yɛ different nti no deɛ ɛka nyina no ɛbɛyɛ ama obi gu wɔ so a na bi a ɛnhɛ da ɛnyɛ ma no nti na tɛm biara na sɛ bi a adwene no ɛnyɛ yi no wobɛpɛ sɛ wo ne wo doctor ɛbɛnya saa nkitahodie no ansa na wɔtu saa anamɔ no ɛneɛ me nua friends, mami musa sa question. I'm say sa question we so your questions adofo bebre enso ewo. Question and say, are there long-term side effects of the vaccine?
Yo, I'm say Sammy, I think say a question I'm say nipa bebre ebusa now say there are actually a lot of conspiracy theories. I mean Trinity. COVID-19 has been with us for less than 2 years. Me fan say the time I nyina hu ye na December 2019. And you said aba. Enti no COVID-19 yesterday no kra no. Yesterday enche vaccine also ya approve ye. It hasn't yesterday and it hasn't been that long. Enti no you really can't say too much of what the long-term effects a bit me aye. But what we do know, they say, you hear other viruses that is COVID-19 SARS, ne de keka ho na, the same family as COVID no. Vaccine na you create at that time no. Yɛde maa nipa na any other viruses no yɛde vaccines that you creating no, they have all been safe. Nti CDC any FDA ɔmo tena ase and they pull together all the information about the side effects of these vaccines, and they are saying say based upon these vaccines that look like this particular vaccine we can say it will be a safe. Can we be 100% sure say it's safe? No, we cannot. We have to be humble about that because we don't have real-time data, but we can extrapolate from other vaccines that are similar to this. It will probably be safe. And but with time, as we have made a vaccine, as other people have taken the vaccine, we will know if there's any long-term effects. However, for now, no dear, we don't have any inkling say there will be if I say you need quite be and I say you need any knowledge say in the past and there has been long-term effects. And you me extrapolate say COVID-19 and yes safe. And say obi also what to be and also person to be ho.
Kakra me da sepam say asem nyina na waka no ba kakra me de ebeka ho ne say experience from other vaccines in the past and so hu say typically no say obi enya vaccine and as obi experience any serious long-term effects and it happen within the few couple of months after getting the vaccine. Where these clinical trials and so now people did not there's not any known long-term side effects people experience in the months after say or more any vaccine. But say the kind we say well COVID-19 vaccine is different and new. And once there's high anticipation said there will not be any serious long-term side effects. It's still new, therefore we still have to wait and see what comes up. And yada sepa and then another question so eta eba pa and say obi say I had COVID in the past, should I get vaccinated? Na manya bi dada COVID instead the nyina nim no nipa bebre anya bi dada. They say manya bi na afei na vaccine so aban, should I get a vaccine? And also what do you say?
A very good question, a very good question, because so you see kind of if you ask me now, you see nipa be 95, 94 million, and then you be into a question I'm saying nipa be brave, sir. So far, no, what we can say is say, so when you're COVID-19 EBR, now you are infection, a tremor, you just have a history of it. Yes, you can get the COVID-19 vaccine, and even in these people, no, still COVID-19 a wow to prevent for future infections. Adeɛ a yɛbɛka ne sɛ when you be in the literature no, the first 90 days after sɛ wanya COVID-19 no, the rate is sɛ wobɛsɛ nyɛ bio anaa reinfection no very low, almost minimal. Nti no sɛ wopɛ nso a sɛ wanya bi ɛnnɛ a, it's okay to wait for 90 days ansa na wagye vaccine, because data kyerɛ sɛ the rate of reinfection no very low. But sɛ wanya bi a na wopɛ sɛ wogye a, you will have to when you infection you will have to wait for 14 days after the infection. If you no wobɛtumi agye. Nti ma me summarize no bio. Menya COVID-19 last 3 months, and then metumi agye vaccine. Yes, metumi agye vaccine. But say menya bi no na within 90 days no my reinfection rate low. Say menya COVID-19 ene anaasɛ last week na menya bi na me ene meda so enya fevers na menya chills you are not supposed to go and get COVID-19 vaccine, because so much antigens ɛwɔ system ne mu, antibodies ramp up. Wokɔfa COVID-19 ka ho a, the for instance the immune reaction no, it will be too much. Into no, you are not advised say active infection COVID-19 no, and then a friend saying 14 days after the infection no, and no now to me agibi menim say na answer question and I say wobɛsɛ wode biribi ɛka ho a.
I think say one answer no and what I can.
Yo, ɛnna ɛmɛ nso mɛbusa a question bi a ɛmɛ sɛ ɛnenam wie mu na ɛmɛ sɛ one of the misconceptions a nnipa bebree ebusa ɛne sɛ, can mRNA vaccines change the DNA of a person? Can the mRNA vaccine no change the DNA of a person? Wanu yie ɛne sɛn?
That's the power. I'm say COVID vaccine we na ban. One thing unique about it is say it use this mRNA technology. mRNA standing for messenger messenger RNA. The aya and say send the information emma o body no say be ya o body no ebetimi ameki ade bi a friend spike proteins. Spike proteins no na eboa emma o body no etimi produce antibodies to fight the COVID-19 virus, because COVID-19 virus also have some spike proteins on its surface. Now, the technology, the way I almost see develop vaccine way no, say spike protein mRNA get into your body now. As soon as it informs the body, the cells to produce the spike proteins, the cells breaks this mRNA now, it's in the vaccine down, and then it's getting rid out of the body. And it does not get into the nucleus of the cell. Now, DNA is located in the nucleus of your cells. This mRNA does not get into the nucleus. Therefore, there's no way scientifically that this thing can get into your DNA, let alone alter it. And the fact is no, this mRNA vaccine cannot alter your DNA.
Yo, medasi pii. Say so is kind of misconception kɛse a ɛm sɛ nipa bebree ɛka medase wakye mu. The other question a ɛm sɛ nipa bebree ebusa ne sɛ mekɔgye vaccine ni bi a ɛbɛtumi ama mayɛ infertile, meyɛ ɔbaa na mekɔgye bi a, m'awoɔ ho ɛbɛtumi ayɛ den anaa ɛno nso